Assalamu alaikum. Welcome to Magical Point. Today's our topic is about asthma. So let's start our topic. First of all, what is asthma? You can see here the definition of asthma. Asthma is defined as reversible obstruction of large and small airways due to hyper-responsiveness to various immunological and non-immunological stimuli. Now we talk about epidemiology. Asthma is a common chronic lung disease of children. Asthma may have its own at any age before puberty. इसका मतलब है कि अस्थमा जो है वो एक क्रोनिक यानी कि पुरानी जो है वो फेफड़ों की बीमारी है जो कि उम्र के साथ साथ खुद ही हल भी हो जाती है प्यूबर्टी से पहले यानी कि बलूगत से पहले ट्वाइस एज मैनी बॉयज एज गर्ल्स आर इफेक्टेड दोनों के अंदर बॉयज एंड गर्ल्स बट एट प्यूबर्टी द सेक्स इंसिडेंस इज इक्वल अस्थमा इज मोर सीवियर इन यंग चिल्ड्रन जो यंग चिल्ड्रन होते हैं उनके अंदर जो है ये बहुत ज़्यादा सीवियरिटी इख्तियार कर देते हैं बिकॉज क्योंकि दे आर मोर प्रोन टू वायरल इन्फेक्शंस लाइक कोल्ड फ्लू एंड बिकॉज द proportionally smaller airway size increase airway resistance. Now we talk about asthma triggers यानी कि वो क्या चीज़ें हैं जो कि अस्थमा को बढ़ावा देती हैं उसको बढ़ा देती हैं ट्रिगर कर देती हैं. अच्छा यहाँ एक बात बताते चलें asthma triggers respiratory infections, viral, mycoplasma, irritants like air pollution, cold air, cigarette smoke, exercise also cause asthma, inhaled like dust mite, ingested allergens, changes in weather like cold to hot or hot to cold, emotional stress, it's also considered in the asthma, medications like aspirin, gastroesophageal reflux, and sinusitis. Now we talk about risk factors of the occurrence of asthma. Poverty, क्योंकि गुर्बत खुद एक बहुत बड़ी बीमारी है. नंबर सेकंड स्मॉल होम साइज 8 रूम्स छोटे छोटे कमरे बने हों. लार्ज फैमिली साइज एक कमरे में बहुत ज़्यादा लोग हों. इंटेंस एलर्जेनिक एक्सपोजर इन इन्फेंसी more than 10 gram of house dust mite allergen. Frequent respiratory infections in early childhood. Now we talk about allergic asthma. In this condition, asthma follow exposure to environmental factors such as diet and pollens. Often, such patients have increased concentrations of both total IgE and specific IgE against the causative allergens. Now we talk about clinical features. Wheezing, जैसे CT. Wheezing is the most characteristic signs of asthma. Patient may have also cough, shortness of breath like dyspnea or chest congestion, tachypnea, and exercise intolerance. Persistent cough, because airway patency decreased at night. Many children have acute asthma at this time. If symptoms are absent or mild, chest auscultations during forced expiration may reveal prolongation of the expiratory phase and wheezing. With severe obstruction, wheezing or bronchially may not be heard because of poor air movement. Flaring of nostrils, intercostal and supraesternal retractions. Central cyanosis may be seen due to severe hypoxia, tachycardia, and pulse paradoxin may be present. Between attack, child may be free of symptoms, but children with chronic asthma are below average for height and weight. The chest tends to be barrel-shaped with an increase in anterior-posterior diameter. The sternum may become prominent and there is development of Harrison's sulci. Now we talk about diagnose. How can we diagnose? Diagnose is mainly clinically, but blood examination like CBC, chest X-ray, it shows hyperinflated and hyperlucent lungs, increased anterior-posterior diameter of chest, flattening of diaphragm, more horizontally ribs, and heart appears narrow and elongated. Arterial blood gases, RAST test, pulmonary function test. Now we talk about management of acute asthma attack. First of all, provide oxygen. Oxygen is administered 2 to 3 liter per minute by mask or nasal prongs, nebulized with salbutamol. Here is the dose you can see here. Adrenaline is not used routinely, but you can use. Terbutaline, aminophylline, and the last one you can use hydrocortisone. Educate hydration. Keep the patient hydrated. Give antibiotics. If bacterial infection is suspected, appropriate antibiotics are given. Ventilatory support may be required if condition is worse.